Here we go. Awesome, great. Well, like I said, I am Karen Katz with the Wisconsin Office of Children's Mental Health. And Alicia is on one of my work teams. And I am absolutely thrilled to be able to speak to all of you in your area about our mental health crisis card. So just a little background, our office, okay, Children's Mental Health, we've been around 10 years and we report to the governor's office. So we are independent of the other state departments, but we are charged to work with them to obviously address children's mental health in our state and hope for better outcomes. If you look for us, we are housed in the Department of Health Services. So that's a little bit about our office. And this mental health crisis card was the project of one of our prior work teams. So we do a lot of work by bringing people together throughout the state to sit on work teams, identify problems, and work of solutions. And so the mental health crisis card was a product of one of our older teams. So here is what the card looks like. And I think that maybe many of you have seen it or have been familiar with it, maybe from some conversations Alicia had in setting this meeting up. But this is what it looks like. It is a small card size. It's a business size card. And the purpose of the card is to tell people who are with a youth who may be experiencing an agitated state or a mental health crisis what to do immediately in those first 5 minutes. The goal is to de-escalate the situation. For our purposes, we talk about the card in the context of youth, but this tool is a great tool for adults to use. So please keep that in mind as I continue speaking. Here on the screen, you see the front of the card and the back of the card. And what we want to happen with this card is here on the front, a youth would list here, there's 3 spaces for them to list calming strategies, things that they know work for them that can calm them down when they're in an agitated state. The front of the card also includes a place for their pronouns. And we do know that pronouns are important for youth. We've seen the statistics that show, for example, if people use the proper pronouns for like a LGBTQ youth, it reduces their risk of suicide. So they're really important for a great majority of our youth. Their name is on the card too on the front. And then you can see on the back side, now this is the generic card. I'm gonna bring up the next slide is the specific card that we developed for your community. But the back offers a little more opportunity for more information. So a primary support person, what that relationship and a phone number, should a youth like to have somebody's name on the back of this card. You can see 3 different ways that a youth can get help or different services, 988 or the National Suicide Hotline, the text Hope Line, and then Speak Up, Speak Out, which is the Department of Justice Office of School Safety's tip line. And then there's a QR code here that youth can click on and they can get to more information about the card. And here is what the back of your card looks like. So Alicia really pointed out that you wanted your local number here for Northwest Connections. So we were happy to set that up for you. So it just looks a little bit different, but it's more personalized for use in your area. Okay, so how do you use the card? It's easy. And really what we're asking people to do, now in your area it will be different because I think you're going to do more printing of the card, but anybody can go to our website, print it, fill it out, cut it to size because it comes on a regular printer size sheet of paper, and then carry it, fill it after you've filled it out, just carry it with you. It fits perfectly into a pocket, a phone wallet, a wallet. Many youth like to take a picture of it so that they could use it that way. And then when they need it, they can present that card to whoever is around them. And then it's time for people to literally read the card and help the youth calm down. Why should people use the card? Well, youth knows what calms them down better than anybody else. One of the things I love about the card is the educational component with it, that we're really talking about and honoring youth voice, empowering them to say, this is what works for me in a situation where I need help to de-escalate. We know that when people follow calming strategies for a young person, that negative results can really be eliminated or reduced. And so the goal is to have those escalating situations de-escalated. Youth, if they are able to present their calming strategies and they're honored, they feel empowered. So anyway, using this card and sharing it with others also should reduce the stigma attached to mental health. So many youth might say, I've never thought about calming strategies. Well, here's another educational opportunity. And we offer on our website, and I've shared a few here on this slide, different calming strategies. If a youth has never thought about, gee, what does calm me down? They can go to our website and they can look and get some ideas. I'm not going to play this video. I just literally yesterday uploaded 4 videos to our website. Well, to YouTube. I don't know if they're on our website yet, but I did put the links to those videos in the chat. And when you get this presentation, these links will take you straight to the YouTube site. But we have videos that with 3 people that talk about why the card is important from different perspectives. So we have a young adult, Nick Crisco, and you're seeing a picture here of Nick, who has a really compelling story to tell about how this card could have helped him. And he actually was one of the people on the team that created this amazing tool. We also have a video of a parent talking about why it's important for parents to encourage their children to use the card. We also have a video from a law enforcement person in Outagamie County, where they have really embraced this card and really embedded it into their behavioral health program. And then there's a video that explains really quickly and shortly, in less than 3 minutes, how to use the card. So I encourage you all to copy those links in the chat if you're on Zoom, or look for this actual document of the presentation when you get it, to watch those videos. They're all really short and they really tell some compelling stories. So I think we can agree the card's a good idea, but we also have been able to do a couple of surveys that really give us some data. So we launched this card in the very end of 2019, so pre-COVID, and the idea was that we were going to go across the state and launch these in schools. And so we did that in Eagle River. And then we also did a couple of launches in the Racine area, and then one in the Green Bay area. And then COVID happened. So it really limited how we could launch this card in person. So we were only able to do a couple surveys. But here I'm sharing some information of a student survey. So again, these students were in Eagle River at a public high school, and then in Racine at the Racine Alternative Learning Center. So 2 very different schools. And 2 different populations that the school served. And here's what the combined results were. You can see here, so we asked the question, how important is it to do calming strategies that are spelled out by you or another youth when you or they are experiencing an agitated state or mental health crisis? And here, 92% of the student respondents said it was somewhat important or very important, with 52% saying very important. So the kids, even after the launch of these cards, when it was a new thing to them, they got it and they understood it. Whether they would use it or not, they feel it's important. Would you feel it would be beneficial in limiting or eliminating negative results if you or another youth presented this card when you or they are experiencing an agitated state or mental health crisis? And here, almost 50% said yes. Only a handful said no. This was intriguing to me, that the 37% said don't know, which tells me that we need to do a little more education when we're presenting this card. And then here's just a couple of comments that youth actually hand wrote on their surveys. I think that this is a step in the right direction. I think that this will help people when they are having problems and cannot speak them. And I think this would be very helpful. And then we were able to do a staff survey in one of the schools. So this was the Racine Alternative School. And again, I just want to remind you of that population. These are students that have severe mental health issues. So we would expect the teachers and the staff working with these students to really get this card and understand the need of it. And the survey really plays that out. So would it be beneficial in limiting or eliminating negative results if youth presented this card when they're experiencing an agitated state? 100% said yes. Would the card help them in assisting a student to calm down? And 80% said yes, and 20% weren't sure. And then again, 100% saying it is important to do calming strategies that are spelled out by a youth when they are in that agitated state. So that's what I have to share on the card. I do always like to talk a little bit when I have the opportunity about data and how are our kids doing in Wisconsin. So each of you, when you introduced yourself, I got to learn that you are connected to families and children in a variety of ways. But I'm here to tell you that our kids are they're struggling. And it's not just a pandemic thing. I mean, we hear a lot about stats and that the pandemic did this, the pandemic did that, but this information I'm sharing with you is showing it's been a trend even prior to the pandemic. So here are some statistics we shared in our 2022 annual report about well-being. 1 in 5 kids self-harm. 1 in 4 girls seriously consider suicide. 1 in 3 feel sad or hopeless, and 1 in 2 feel anxious. And again, this is the source for the data that I'm sharing is the Youth Risk Behavior Survey. We take a look here at anxiety, and I think the thing to point out from that just support the general comments I just made is here, females are really experiencing anxiety in much greater numbers than male. So here we have 66% of the gals that took this survey said they were self-reported as having anxiety. And here you can study this when you get this presentation. We like to break things down to identify disparities whenever we can in our office. And here, even though there is a difference between the 3 groups of folks we're calling out here, but we're seeing that Hispanics are experiencing anxiety in greater amounts than whites or blacks. Again, the depression, we can see that our young ladies are really feeling it more than our young men. 46% of the gals responding to this survey said that they were experiencing depression. And again, you can look at the breakdown by race here too. And again, that self-harm, here's the data that support the general comment I made before. 31.6% of females said that they have self-harmed, compared to 11.8% of our guys. And then the last data point I'll share with you are seriously considered suicide. This is sad. 24.6% of our young ladies have seriously considered suicide. Rather alarming. So that is what I have right now on the card. We'd like to break here for questions. What I will do is stop recording